So I wanted to now change to something that I'm much more engaged in, and that's MRI imaging. And in this example of the TMJ, we already know it's the accepted standard for soft tissue imaging of the TM joints. Going back to our guidelines, they state that. We understand what the recommendation is. And they also go to a nice way and they say, well, what kind of MRIs would we be using? We'd be using a proton density or T1 weighted image to look for anatomy, and you'd use a T2 weighted image to look for fluids such as synovial fluid, like effusion or that aspect of things. So the standard type research, this is research led by Eric Schiffman and Mansour Ahmad, and they published a series of pictures kind of showing the gold standard of where we're at with MRI back in 2009. And you guys can read on the top panel, the first three are normal positions, and then D and E are indeterminate. They look like they're slightly anteriorly displaced, but maybe, maybe not. And then F, G, and H are showing clear anterior displaced, and these are the parasagittal positions. And in these instances, it's proton density weighted. So it's pretty straightforward, cut and dried. This is our blood and guts, what we know all the time. If we do a paracoronal, same sort of presentation, you can look at the lateral aspect to it. So in other words, is the disc displaced medially or laterally? G and H are medial displaced discs. D, E, and F are laterally displaced. And you can see how the bunches up, over here. Kind of an interesting angle for me to get to there. But it's pretty darn clear. And then your T2 weighted images, they look a little bit more grainy because they struggle a little bit on the signal to noise just because of the way the pulse sequences run. But what you can nicely see in these examples is you can see the fluid. And so you have fluid in the anterior and then in the two spaces, superior and posterior space. So again, this is all stuff that we know. So where is this field going? And this is some research that's unpublished. And as I've been working on this area, one of the questions that I always ask is, okay, as we think about making technology cheaper and more accessible to the average clinician, how do we know we get to good enough? And so here's something I want to kind of present to you and see if I can get some audience participation on. So in this research, we were looking at using a typical clinical scanner, a 1.5 Tesla scanner, in the normal setup that you would for TM joint imaging. And our test scanner was a 0.55 Tesla scanner equipped with a custom-built surface coil. We took the typical types of images. So these are proton density weighted in the parasagittal, paracoronal, as well as our T2 weighted images. And we did this on 5 healthy participants. And then we sent the pictures to have my residents, my faculty colleagues, as well as a radiologist and a radiologist and neuroradiologist look at it. So here's the audience participation. One image is from the typical clinical scanner. The other is from a 0.55 MRI scanner. Which one's which? So the audience participation part is, who thinks the image on the left is the 0.55, the new scanner? So I got a few people. Who thinks it's on the right? Okay. People on the right. Got it. Okay, you want to go to the next one? Here's your coronal. Taking a look at the image. Who feels it's on the left? Left. There's a few people. Okay. Who's on the right? It's on the right. Do you guys find these easy to tell the two? Okay, here's another one then. It's going to T2-based images. Who's on the left? Who's on the right? Changed it. It's on the right. And so this is unpublished research, but we went with our gold standard neuroradiologist who does this for a living. he could not tell the difference between the two different scanner systems. And so maybe we're good enough. And so the part that I'm really excited to talk to you guys about is the development of an MRI scanner that's being designed and made specifically to address dental practice. And this is just a schematic of kind of outlining cone beam CT as it's went over time on the bottom. And we're very familiar with cone beam CT coming to the dental audience. And so what industries looked at is this lag, and they're like, hey, it looks like it's time for MRI from a dental perspective now. And so I've been lucky enough to be working with them for the last 2 years, and we just publicly announced 8 days ago that we are actually in the process of making an MRI scanner for dental practice. So you may want to ask, and you've probably seen this acronym of DD-MRI that I'm putting there. That's a terminology that they've came up, and I wanted to just basically define it for you. And so it's a dental dedicated MRI scanner. And what it is it's tailoring of the hardware, the software, and the workflows specifically for acquisition of MRI in dental clinic settings for dental education. So in other words, it's being made for you. So we're looking at hardware such as radio frequency coils, gradient coils, magnets. We're looking at the pulse sequences, and this is what one of the big parts that we looked at, and I kind of showed you with that last image, set of images, looking at how to compare them to be able to look at pathologies, and that's where we're at right now. We're also moving towards kind of more push button, so you take the guesswork of being able to, what image type do I take for this indication? We're working through all that. We're also simplifying the workflow and the equipment positioning so that each individual person can be imaged in a setting of less than 20 minutes. So you should be able to scan 3 patients within an hour. And then the interface. So in other words, when you're looking at the computer, it makes sense. Right now, MRI is set up for physicians and how they do it, but that's not how we look at information, and so we've changed that on the dental side of things. So this is what the scanner's looking like right now. So industry's taken the position of they're making a step forward into the dental market. They're using existing technology and tailoring it to kind of see how dentistry responds to it as they have now it being tailored for them to figure out what their next step is. And so the parts that I was telling you about that they've been working on obviously is the gradient coils, the magnet itself. The magnet itself is smaller while it has the same form factor. It looks like a big scanner. It's about 2/3 to 1/2 the typical side, and the sighting requirements are smaller. So they've kind of made it somewhat smaller. It's not yet a cone beam CT size, but there's clearly a desire that that's where dentistry is going to want to go with it if dentistry is interested in keeping MRI in their practice. So who's bringing this to you? And so this is where my conflict of interest comes in, because I'm a consultant for Dentsupply, so I wanted to make that clear. So I've been working with these 2 companies over the last 2 years. And so it's myself and Ruben Spinetto, and you'll see his name come up later. And what are we doing? We are looking at, can we move to more functional imaging? Can we look at soft tissue differentiation for dentistry, which we don't have? Can we look at actually imaging inflammation? Can we do a better job of depicting nerves, things that we typically can't see? And on the flip side to it is can we also start avoiding radiation when we have elective type procedures like orthodontics or implant placement type approaches? And so this is a picture of Ruben's. He has the first scanner in the world, and it's sited in July up in Aarhus, Denmark. So this is Ruben's here with his team. And this is an example of the custom-built, this is a prototype facial coil that is being used right now for some of the images that we were just showed you. And this is some work that we're kind of at now. We've got some of the basic stuff already worked out, like I showed you. But what about the next steps? I don't want to just do, is it same as? Can we go a next step further? So one thing that I'm challenging industry is, can we maybe move to a one modality? Is the depiction of bone good enough to determine DJD on an MRI? In the existing MRI, the answer is no, it is not. But can we tailor it so that we can get there? What you're looking at here are ultra-short T2 images. It's called a UTE pulse sequence. And what you're seeing is the bone is dark because there's very little signal from it. And in this pulse sequence, it makes a soft tissue really flat. So you can't see the disc. You can't distinguish it from its other areas. And so this is in its native form as it comes off. But we can also invert it. And so this is a different patient, a couple of them actually. And this is an inverted MRI that's depicting the bone. And this is without a lot of work, and our resolution is 0.6 millimeters isotropic, which is about where you're at with some of your wider field of view cone beam CTs. And so the question is this going to be good enough to be able to read off DJD, and we can move to a one modality type assessment of the TM joint. Where this field's at from this technology, following the Freiberg and Thornberry approach, is we're at these early stages. And so they set up a 6-stage hierarchy. Remember I talked about the concept of screening tests? That's up here, where you have these big patient outcomes and large social determinant aspects of where imaging affects at that level. We're way over here. Can you get the things that you want? Can you start looking at separating tissues and now disease versus not disease, and can you actually get to the diagnosis aspect? So we're really in this 1 through 3 phase as we're looking at developing technology, and we can say it will be successful if we can make the jump to changing therapeutic decision based on imaging. That's when we say, hey, we have success. But going back to what are other things that you can kind of do? So in other words, not just the low-hanging fruit, can we actually take it to another level? Can we do to actually true functional imaging, which is being used mostly as dynamic MRI. So it's 4D imaging. And so this video comes to you via NORAS. So they're a company out of Germany, and they make this coil what's available that you could purchase and put on most MRI scanners. And as you can see, they can get 4D images off that, and you can actually see functionally what's going on in the TM joint. So interestingly, that's not that new. So back in 2009, Peter Jacob, that's his lab, it's a fairly famous lab out of Würzburg, has worked on functional imaging. Our physician colleagues are doing functional imaging on wrists and that aspect. You've had more coming out of the mid-teens. This group is out of Orofacial in Ulm. You got the Jens Fromm. He's done a lot of work also in this in Guten. And then there's actually groups that aren't as famous for producing functional dynamic type imaging that are also applying these and looking at it in the TM joint. And I think it sets up the situation now where maybe we can move to actual dynamic type imaging from a TMJ perspective, which gets me exceptionally excited because now we can look at our anatomy and be able to understand how things are moving in our patients, because they don't live in a static world that we look at our current MRIs at. They live in a dynamic world, and hopefully we'll be able to access that dynamic world.